What to expect during cataract surgery? That's a question many of my patients often ask. If you're soon to have surgery or you have a parent or friend who's scheduled for such, then this video is for you. Welcome to Eyes on the Road. I'm Dr. Keith Poindexter. If you're watching this video, most likely you've been diagnosed with cataracts or know someone who's been diagnosed with cataracts and is now scheduled for surgery. If you don't know what cataracts are, you can see my other video at the link above. On the day of surgery, when you arrive at the surgical clinic, you'll be taken back by one of the nurses. You'll get to meet the anesthesiologist. They'll review some of your health history. They'll make sure who you are and what you think you're there for. Make sure that they're operating on the correct eye. Your cataract surgeon will also come in and speak with you prior to the procedure, again, to confirm what location the surgery is going to occur. You'll be given a little bit of a sedative through an IV to calm your nerves. Typically, most patients, because of the sedative, do not remember the surgery itself. Some things to expect during the procedure, if you're one of those lucky ones that can remember exactly what happens during the procedure itself. Number one, they will put a drape over your face such that the only part of your body that is exposed to the surgeon is the eyeball itself, the operative area. This is not a big deal for most folks. However, if you have a little bit of claustrophobia such as I do, sometimes that can be a little freaky, and yes, I have had cataract surgery myself. The second thing you may remember is your surgeon talking to the surgical team. Sometimes this is about your surgery itself. However, oftentimes it can be about the game the night before or the birthday party of the nurse's son or daughter. Don't feel like this is distracting from your procedure. Just like you can work at your office and can have a conversation about something completely different, so too can surgeons and their assistants. The third thing you may remember during your procedure is they use a lot of irrigating solution to keep your eye moist during the surgery. The cataract surgery itself usually only takes about 7 to 10 minutes. So any of these potential difficulties you may have during the surgery are short-lived. In my opinion, if you've been through a dental procedure, you can easily tolerate a cataract surgery. If you're curious about the exact details of the surgery itself, you can see my other video at the link above. After the surgery is completed, you'll be taken into a recovery room where you'll stay for about an hour or two until you're ready to release back to your home. Once you arrive home, you'll be instructed to restrict your activity. And by this, we mean no heavy lifting, no bending at the waist to where your head is beneath your heart. We'll ask you not to rub the eye. You'll be wearing a shield at night so you don't rub your eye accidentally while you're asleep. You'll also be prescribed several drops, which usually include things like an antibiotic to prevent infection, a steroid eye drop to reduce inflammation, and occasionally a non-steroidal anti-inflammatory drug. This helps to manage pain as well as to prevent swelling in the back of the eye, the macula. If you have your surgery early in the morning, your first post-operative visit may be later that same day. Several surgical centers to where the patient may drive a long distance to have the surgery plan on this strategy. However, most local cataract surgeons will see their patient the following day. If not, they'll have the referring doctor see the patient for a one-day post-operative visit. At that time, our goals are just to make sure that you are healing well with no unexpected complications. The restrictions on activity and drops continue through the first week, and you're normally seen about a week after that first procedure. If at that time everything is going well, typically the restrictions are lifted and they schedule your second eye if it has a cataract that is in need of surgery. You'll use your post-operative drops for almost an entire month. Usually we will consider prescribing glasses at the 1 month visit. However, in certain cases, if glasses are needed, we can consider prescribing as early as that 1 week follow-up. If you have any questions that you would like answered, please feel free to leave them in the comment section. Obviously, you're welcome to subscribe to the channel so I can keep you up to date on any other advances in eye care, not just cataract, but other diseases and or optical options and new technologies. And as always, remember, when you change the way you look at things, the things you look at change.